A lot of people with severe back attacks are also very concerned about the cost because, again, back surgeries on the average, according to Mayo Clinic, is around $77,000 for a single level. We've had patients who've had multiple levels, charge $250,000. And it doesn't stop there, because then you go into rehab, additional pain pills, muscle relaxers, physical therapy. Most people, according to the research, are disabled from work, so they're homebound. And then they get to develop what's called the quiet epidemic, where their joblessness, hopelessness, chronic pain, drug use, they just go down a toilet. It's so sad. And that's when we see some of these people that come to see us and they're just hopeless. So you can't help it. But as I mentioned before, is that for some reason, even the insurance companies are happy to pay $80,000 for surgical decompression that has a 46% success rate. On the other hand, the insurance companies don't want to pay for non-surgical decompression by the DRX9000 that has an 86% success rate. I will say there are a couple of insurance companies that are reconsidering that because they see the writing on the wall, that they will save a lot of money by sending people in for our brand of care. But for those people who don't have insurance at all, or those that we know they won't pay, I want you to know that it's not that expensive. The cost of a 3-month, 24-visit program on the DRX, plus all the adjacent things we do, like adjustments, the standard retail price is about the cost of a set of braces on a child. And we even discount that for the military and TRICARE people to where it's about equivalent to a tooth implant. I know, because my dentist told me I needed one. And I said, what's the cost? And it was the same price. So it's around $4,000 to $6,000 depending upon the case. But we work with people, we use care credit, we put them on payment programs. We don't want anybody going broke getting well, as I tell patients. But I think what really needs, you need to value the treatment. I mean, what's it worth to you to avoid back surgery, to avoid a 50% failure rate and a life of disability? I see those people. Some come to see me afterwards. Too bad they didn't come beforehand. But what's it worth to you? Is it worth you to invest in money now to learn how to take care of your spine for the rest of your life? That's what we teach people. It's not just a treatment we're selling. We're selling advice on how to manage your back problem for the rest of your life. That's my second main goal here. And that's why patients like coming here, because we do more than just deal with the initial back attack. We teach them how to avoid them in the future so they don't relapse. But again, are you willing to invest in your health? Are you the type of person that takes vitamin supplements, who goes to other type of alternative providers? I mean, are you really into being healthy, or you just go from like toothache to toothache with no toothpaste in between? That's what I tease patients. If you're not willing to do the ounces of prevention in your health care and your spinal care, then you will relapse. And I have patients that do that. I call them my prodigal patients. I see them from back attack to back attack to back attack, but they don't do anything in between. I say, well, why weren't you here for maintenance care? Well, I was feeling great. Wonderful. Then I say, does that mean you don't brush your teeth when they don't hurt? And then they laugh at that, because people have been taught an ounce of toothpaste is worth a pound of getting drilled by the dentist, right? We all agree to that. So nonetheless, I want you to take that dental attitude and apply it to your spine. That's what we do here. We teach people how to take care of their spines. We put them on an anti-inflammatory diet, a walking program, and all this is a health program that we're offering you, not just a back pain program. And that's fine too. We do a lot of that, but I want patients who really invest in their health, people who value good health and value good advice. So if that sounds like something you want to do, and you qualify for our care after our examinations, we'll be glad to work with you any which way we can to help you get well once and for all. Otherwise, thanks for watching. I'll see you next time.